Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast. Welcome back to all the Med Edit Podcast listeners.
Hello, Dr. Gray, and welcome everyone to today's fascinating episode where we cover the truth about vaping and the TikTok trend of mouth taping. I love that little rhyme.
Ooh, sounds interesting. First off, when did mouth taping become a thing? I feel like that just popped out of nowhere. And hey, that's TikTok for you. Now, vaping, on the other hand, that has been around for a little while, and it's definitely something that we need to talk about and bring back to the forefront in the news. A lot of people think it's safer than smoking cigarettes, so it might be fine to do, right? Today, we'll be joined by our favorite pulmonologist and critical care physician, Dr. Ximena Solis, to break down the fact from fiction for us. Today on the show, we have Dr. Ximena Solis on our podcast. She is a busy pulmonary critical care specialist for Covenant Medical Group here in Lubbock, Texas. Welcome to the Med Edit Podcast, Dr. Solis.
Thank you so much for having me.
All right, Ximena, let's start with the basics. What is vaping? Are vape devices and e-cigarettes the same thing?
Well, vaping is inhaling basically any type of aerosol. Vaping and e-cigarettes are basically the same thing. They're synonymous. They kind of refer to the inhalation of any aerosol. It can be nicotine or not, flavored or not. And it is becoming more prominent kind of here in the U.S. and worldwide as well.
In case our listeners actually not ever seen one before, what do these devices actually look like?
So they can look like anything. And that's the big danger with, especially with children. They make them to look like just a plain block, or they can be like a USB. They can be shaped like their favorite cartoon characters, anything, any shape, really.
That is kind of scary, right?
Yeah, it reminds me of like when we were growing up. I don't know if you guys remember this, when the safety officers would come and it was like the stickers that had stuff on them.
Oh,
that
yeah,
looked
the
like
stickers.
Regular stickers. I mean, I assumed like everyone was going to get LSD from stickers.
Or the lollipops were a thing back then too, the heroin lollipops.
Kind of reminds me of that, right? Yeah. Exactly. Okay. And what is in these devices? Is it just flavored liquid or is there more?
Well, it can be, that's the scary part. It can be really anything. The FDA does not regulate what goes into these carrier fluids or nicotine amounts, anything. So when you're buying one of these products, you think you're buying one thing and you really could be buying anything. And what is really dangerous about these is a lot of them contain carrier fluid that contains oil. And oil is what can actually damage your lung along with the nicotine.
I feel like that was really in the news right before COVID happened. It was in the news and everyone was talking about we'll talk about the vaping associated lung injuries and which oils were safe and which ones were not. But now we're not hearing about it anymore. It doesn't mean it didn't go away. So many people think there's no risk associated with vaping. What's the truth?
The truth is there's a great risk. Before the pandemic, I remember being in training and having to list patients for lung transplant, even because the damage on the lungs was so severe that these patients could not recover. And what was very hard to watch is these patients were younger than I was. They were in their teenage years. They were in their early 20s, and they were basically, their lungs were ruined for life to the point where they needed a transplant.
Oh, that is heartbreaking.
Yeah.
So vaping is really harmful.
It is.
It's not regulated. It's not controlled. So, can you get addicted to vaping products?
I think the habit more than anything, a lot of people think they're quote unquote safer because they're not traditional cigarettes. But in reality, they can contain just as much nicotine or more nicotine than traditional cigarettes. So imagine a young child accidentally buying a vape with 10 times more nicotine than a usual cigarette, and they can actually get toxicity from this. It's very dangerous.
I think it's crazy to think that nicotine is actually the third most addictive substance behind heroin and cocaine.
Oh, that's crazy.
I mean, that's crazy, right?
Yeah. Mm-hmm.
So like in general, like it's just easier not to get addicted in the first place because it sounds really hard to stop once you are.
Correct. Yeah. I see patients all the time in clinic and they have end-stage COPD, they have significant impairment, and they just can't stop. They have quit other substances such as alcohol or illicit drugs, and they just can't stop smoking. It's impossible for them. They say it's physically impossible.
We've also known nicotine's toxic to developing fetuses. It's a health danger to pregnant people. I have had pregnant patients that say, "Well, I quit smoking and now I'm vaping."
Mhm.
It's not safe in any way. We can't claim it's safer either. It's a lot of things you're looking at, especially when we're talking about the oils and the potential harm that specific part of it, not even nicotine, can do to the lungs.
Absolutely. And I did see actually that the FDA was looking at potentially that nicotine overdose that you mentioned and actually
Mm-hmm.
seizures in general from that exposure from vaping, at least especially kids younger than 5.
Oh, that's terrible.
Yeah, and also too, vaping, the carrier fluid, if it contains a lipid substance, it can cause what's called a lipoid pneumonia. And some of that, to some degree, is reversible, but for some patients, it's not. And so you can have lasting lung damage from this. You can become a pulmonary cripple from vaping too much. And, some people are lucky and they're able to recover, but others are not. And that's something a lot of people don't know.
I had a patient who she kept coming in for like atypical chest pain type symptoms. She kept going to the ER. She was only 19. And so we kept trying to figure out what was going on. She had a million worth of tests done, and it really ended up being her vaping. And it was really, number one, it was making her anxiety worse with the nicotine levels she was doing, this whole process. And then, the anxiety was creating bigger issues. Then all of a sudden she was having some shortness of breath and some lung issues and this chest pain. And so and poor thing, it was really hard for her to come around to the idea that it was from the vape pen. And finally, we were able to kind of pull her off of it, but it almost became a really big, like, she needed a support group. She needed a whole lot of things to get rid of it. So it's better to not even start, right? If we can.
It's better not to start. Yeah, a lot of people think it's safer, but it really is not. I always tell my patients to avoid both cigarettes and vaping, kind of as a blanket statement, just because of all these potential risks.
Right. Because we did see that, I think it was like teens that tried vaping were like 4 times as likely to do traditional cigarettes at some point, anyway.
Correct.
So the whole like premise that you're not going to smoke cigarettes, and seems like it's pretty likely that you will.
And I think what's hard is in schools and things, like they have a hard time, with regulating that because their kids are sticking in their backpacks. They're bringing it, home because they know it's like a parent's vape pen or a parent's vaping
Or it looks
device.
like a USB.
Oh,
I mean,
yeah.
Like, how do you even regulate
I saw one
it?
that looks like a highlighter.
Yeah. I mean, it's hard to keep on track of. Well, speaking about all of this, I mean, why is the Surgeon General and the FDA classified vaping as an epidemic at this point?
Well, I mean, we didn't hear about it. It kind of stopped after the pandemic with COVID-19. But it is still a problem. It is still, I see patients, that are young and you wouldn't expect them to have any pulmonary impairment at all. And they have lasting reactive airway disease that's resistant to most therapies. So it is a problem, and not a lot of people, I guess people forgot about it technically. I mean, after the pandemic, I feel like it's just kind of pushed under the rug, but it is still quite a big issue.
What about people who might have asthma or COPD? Is there any effect that or warning that you would give them?
Absolutely. So anytime you have any type of reactive airway disease, and that can include COPD and asthma, and a lot of times after having COVID, people are having more reactive airway disease. Anything that deposits on your airways can trigger it basically and cause a reactivity. And you can end up in the ER. You can end up admitted to the hospital because one of these carrier fluids or something triggers your airways to the point where you need to be seeking medical attention. So it is serious. It can make whatever you have that's already underlying, it can make it worse.
Yeah, and I think it's important to acknowledge the fact that there's no vaping product that has been approved by the FDA as a safe and effective way to quit smoking traditional cigarettes. And there aren't any studies to really show about the long-term side effects. Like you said, it kind of went by the wayside, I think, with COVID coming around. And I think it's definitely something that needs to be looked at more, kind of long-term side effects.
We've talked about this before, but in 2017, the FDA actually published a rule clarifying that products made or derived from tobacco are regulated as tobacco products, including e-cigarettes and vaping devices. And while the FDA has issued enforcement policy on flavored e-cigarette products, including fruit and mint flavors that appeal to kids, manufacturers are finding loopholes and continuing to market the flavors to kids. So they kind of knew, hey, we've got to stop this at some point because these flavors that maybe adults want, but really kids are going to be the ones doing it. The high schoolers like, yeah, I just want it because I want mint flavor and I look cool walking around with my vape pen that I'm secretly hiding from my teachers. It's more of that like, thrill and the rush there, but it really is dangerous. And a recent report revealed that 85% of kids who vape use flavored vaping products such as fruit, candy, menthol, and mint. And one of the other things I want to throw out there is that we can smell it, guys. Just because you are not like actively lighting up a cigarette, people can smell it all around you, and it can be triggering for people maybe who have really sensitive allergies or really sensitive asthma.
Yeah.
Absolutely. Yeah. If it's just imagine all that cloud or that fume is going into the environment, anybody around you can be affected by it. It's not filtered. It's completely out there. So anybody can be triggered by it, which is also a danger.
Yeah. And I think it's interesting too, is a lot of people think like if they don't smoke traditional cigarettes, the risk of cancer is like zero. But, from what we've seen of some of these vaping products, because there's not a lot of regulation, that there's been, that they have found that, some of these substances, they don't know what they do that are in there. Like, they're chemicals and we don't really know what they do to people's lungs or their bodies. And so there's that cancer risk is not necessarily zero just because you're not smoking traditional cigarettes.
Yeah, absolutely not. Any type of inflammation, the lungs are very sensitive. They're very nitpicky organs. They don't really handle a lot of stress or change. And anytime there is any kind of inflammation, this can predispose you to having malignancies in the future if you're genetically predisposed to having that. So, yeah, it's not completely not without its faults. Absolutely. I'd agree with that statement.
Yeah. So repetitive damage over and over and over again is going to potentially cause long-term effects, even cancer is what you're pointing out there.
Right.
One of the things I always tell my patients too, especially when they're smoking, if they have COPD or something like that, we say, the day you quit smoking, the day you stop putting some kind of damage to the lungs, that's the best your lungs are ever going to be, because they don't reverse, they don't heal. It's not like your liver that it can have some regenerative change and growth. Your lungs, that day you quit, is the best they're ever going to be, because you're not going to heal up some of that damage that's already been done. So you think about vaping, and if we're starting when we're 15, 14 years old, the damage we're doing there, you're never going to get your lungs better again. And that's absolutely heartbreaking to think we're talking about kids damaging their lungs like that.
Not even teenagers. 5% of middle schoolers now apparently do vaping. So, it's starting way younger than that. So you think about what your lungs are going to be at by the time you're like our age.
Oh no, that's terrible. Oh, we're not even old,
I know,
right? Let's call ourselves that.
That's what I didn't say old. I just said our age.
Yeah, absolutely. That's what you got to show these middle schoolers. And I guess who knows if it actually works, but you just got to think like that damage you're doing that day is what's going to be the determination of whether you are in your 50s and 40s walking around with an oxygen tank and, a nasal cannula in your nose. That looks really cool.
Yeah. And the thing is with the lungs too, if you have chronic inflammation, there's always a risk of fibrotic disease. And once the lung becomes fibrotic, there's really nothing we can do. People are pulmonary cripples for the rest of their life. And it is hard to watch. It is hard, and it is something that is self-inflicted, which is even worse in my opinion.
Yeah,
so
absolutely. Yeah. Okay. Wonderful. Well, that has been great information, Dr. Solis. Our listeners are now very well informed about vaping. So don't let someone try to blow smoke about vaping in your direction, okay? We are on a roll with puns today, by the way. I just want to mention that. We are killing our puns today. Okay, I will be honest. The first time I heard someone advertising for hostage tape, I guess as they say, for sleep, I was both intrigued and very confused at the same time. Like, what the heck? But, there's a lot of TikTok trends out there that I say that about. So Jess, what is mouth taping?
Okay, so I take full credit for this. I saw this and sent it to Cari and was like, girl, we have to talk about this on the podcast. This is crazy. So I'm glad you thought it was just as crazy as I did. But mouth taping, apparently, because I've never heard of this before until this TikTok video. Mouth taping is an increasingly popular home treatment that's supposed to be used to encourage nose breathing during sleep by literally placing a porous tape over the mouth before falling asleep. So taping your own mouth shut. The hope is that it encourages people who maybe typically are mouth breathers to nose breathe, and that way they could theoretically get better sleep at night.
Interesting. Okay, I will say that when I mentioned this to my husband, he was like, "It sounds like you're just trying to murder me in my sleep."
My husband said the same thing. He was like, "Isn't that just going to kill you?"
Yeah, he's like, "Is this another ploy to get rid of me?"
Right.
So what kind of benefits are people hoping to achieve from this, Jess?
Well, this is another example of sometimes when people who maybe don't have the proper medical education are trying to connect the dots between A to Z, and they miss all the other letters in the middle, right? Because just taping your mouth shut at night, theoretically, they think is supposed to make it so that you can fall asleep easier, and it will make it so that you're not snoring. So if you don't snore, then you'll sleep better, is the idea, right? And then they also think it will help for if you have maybe bad morning breath and dry mouth, which, to be honest, for morning breath, especially if you're laying next to somebody, I don't know if it's better to have morning breath or wake up with somebody with tape across their face.
That's a great question. Do we have any evidence if this works for the supposed benefits people are looking for?
No, we do not. And in fact, there might be some more concern about it, which we'll get to. But most of the information is anecdotal, meaning it's based on personal accounts rather than facts or research. We always claim around here that we talk about a lot of evidence based medicine. That means research based medicine, real research, not just one trial or one study or one person talking about it. So far with this mouth taping business, we only have a small, limited number of studies of roughly 30 patients or so that demonstrated a possible benefit of mouth taping in reduction in snoring and tiredness in people with mild obstructive sleep apnea. So a study with just 30 patients in it is not very big.
No.
I mean, we need a lot more to make it actually statistically significant. Even though nose breathing filters out allergens, so that's a good thing, adds resistance that benefits lung volume and delivers warmer, more humid air to the lungs, studies on mouth taping for people with asthma have been found to have no benefits. Now, mouth taping may also make treatment more effective for people who have sleep apnea and use a CPAP machine while they sleep, because mouth breathing can affect the acceptance of CPAP usage. But we need way more research on it. So basically, all that being said, if you're somebody who does have to wear a CPAP at night, it has been difficult for those patients to use it sometimes, because if their mouth is is open, it's blowing air into their mouth, and that's not where it's supposed to go. It's supposed to blow air into the nose. So this is maybe where some of this started. Maybe there was some research on this originally saying just tape their mouth shut and then the air will go straight through their nose like it's supposed to. But true use for that in a medical need has not been well studied at all.
Okay. Alrighty. And, obviously we talk about risk versus benefit all the time. So we've talked about, why people might try it, what benefit we maybe see out there if there's any. So what are the risks?
So let's talk about the littler things. But yes, like irritation on or around the lips because it's tape, right? Pain when ripping off the tape, disturbed sleep due to irritation from the tape, or difficulty breathing through the nose. And the difficulty breathing through the nose may be the bigger issue there, right?
Yeah.
Also, anxiety. For those who feel uncomfortable having their mouth taped shut, that doesn't sound very pleasant.
You mean everyone? Yeah. I feel like everyone should have anxiety about that.
In the middle of the night, you wake up and you're like, I can't move my mouth, my face. Like that might be very anxiety provoking. And overall, just discomfort or difficulty with breathing, having it on. It's important to state that the porous tape designed to be used on human skin has been used. So masking tape from your garage is not a good option. So it's branded hostage tape. It's scary enough. And it's black and it looks like something out of a movie. Definitely one of the, I don't know, James Bond or The Taken. That's what I'm thinking of. It's like Taken. Yeah. For sure. It looks like that. But it is different than your tape you would find in your garage. So please, even if you're listening to this, do not go grab your duct tape and stick it across your face. That's absolutely terrifying and not okay.
So maybe, somebody's listening to this and they're looking for some of the benefits that this intervention has touted as a possibility. What are some suggestions that we maybe have a little more evidence behind that could help them?
So if we're trying to get some better sleep and we're not going to go to taping our mouth shut, try side sleeping. Decades of research demonstrates that both people with and without obstructive sleep apnea snore less when they sleep on their side instead of on their back. Also, sleeping with the head of the bed elevated or on a wedge pillow is very beneficial. You can also consider nasal strips. Okay, so we're not obstructing anything with this. We're actually opening passages. So, nasal hip strips are adhesive devices placed on the nose to expand the nasal passages and encourage nose breathing. Studies of nasal strips have produced mixed results, with some showing an improvement in snoring and some showing no effect. Funny enough, I can comment on this because during pregnancy, I always snore. It has nothing to do with, weight gain, as a lot of women pregnant always think it does. It has more to do with the vasculature in the nose and stuff when you're pregnant, what happens to it. So with that being said, if you use some of these nasal strips, actually can be very beneficial, especially for people in pregnancy where it's not sleep apnea related. It's more related to what's going on in that nose. Sure. So try that out.
Okay.
But treat allergies too. Around 25% of people in westernized countries experience an allergic reaction to substances they breathe in, such as pollen. This reaction often involves nasal congestion, which can make breathing through the nose more difficult. On that, I always recommend the nasal steroid sprays. Flonase is fantastic.
Yeah.
People will come in to me talking about that, and they say, "Well, I tried Flonase; it doesn't work." Well, big things I always ask. Number one, how are you using it? Are you using it daily, or are you just using it as needed? Okay. Using it daily does nothing. You have to use it every single day for it to decrease the inflammation in the pathways for it to be effective. And then also, if you're spraying it up your nose, going straight up your nose and back down your throat, you're essentially drinking it.
Yeah.
And that's gross and not effective.
Right.
So you need to make sure there's a little finesse to it. So a doctor can help you with that. I mean, that's a great time to watch the videos they have online for it. So
yeah. And we are going to have our allergist friend on too here in the near future to talk about some more allergy tricks too.
So definitely address those allergens for sure. If you're looking to reduce daytime tiredness, which some people claim mouth taping can accomplish, make sure you're practicing good sleep hygiene, like going to bed and waking up at the same time each day, sleeping in a room that's free from light and noise. Avoid looking at screens before sleep. That includes your phone. So you're not supposed to be scrolling through TikTok or looking up the most recent drama about Bridgerton love characters.
Gets me every time.
Somebody I know here who's going down a rabbit hole before bedtime, and now she can't sleep because her brain is just being stimulated from that light. So, avoiding you from your phone. Don't sleep with the TV on. Skipping alcohol and caffeine in the hours before bedtime actually is very beneficial. A lot of people say, well, I'd sleep better with alcohol before bed. You might initially fall asleep better, but studies have shown you will wake up several hours later and have worse sleep when trying to go back to sleep. It'll make it much more difficult, and even that you'll get less rested sleep. And then, of course, caffeine, we say nothing after 2 p.m. if you can. Exercising regularly is very helpful. We just advise maybe don't exercise right before bedtime. Try to put at least 2 to 3 hours in between your exercise regimen and then falling asleep. If you think you have a sleep disorder causing sleeping problems, and so that's a difference. If sleep disorder is a true issue, make sure to talk to your doctor. Sleep disorders are conditions that require professional diagnoses and treatment rather than your home remedies like the hostage tape. Don't try mouth taping instead of visiting your doctor. If you do, this could really delay the start of an important treatment. Things like we were talking about sleep apnea have very big side effects if not treated. Things that even include irregular heart rhythms like atrial fibrillation that could be deadly, could cause stroke. There's a lot of other really scary stuff. So don't go treating yourself just like TikTok says. It's also important to see your doctor if your child has an issue with mouth breathing. That's pretty common. Mouth breathing may slow growth in children, so it may require medical attention. Mouth taping in children has not been studied, and please do not try. That can be very dangerous.
Yeah, definitely don't do that for sure. What a great episode. I think we've really clarified some of the confusion around vaping, and now I know much more about mouth taping with hostage tape than I ever thought I would need to know. And to be honest, so like a month ago, didn't even know it was a thing. Listeners, it isn't easy being wheezy, so take care of those lungs.
Thank you again for joining us today. Please come and join us anytime when you guys are trying to learn more about these fun topics that we keep finding for you. As a reminder, don't forget to check out the show notes in order to claim your CME credit if you are one of our medical listeners. Thank you all for listening. Please like, subscribe, share this episode. Let us know what other topics you're interested through our Instagram. Send us a message if you find something else that just really you want to know more about. Stay tuned for our next episode.